Here is Fox News doing triage. I am quite convinced that this segment would not have happened but for really from the Fox News perspective, from the president's perspective, from the perspective of anyone who was against single-payer health care, from the perspective of people who are desperate to not have Bernie Sanders be the Democratic nominee and potentially the president of the United States. From all of those people's perspective, the Fox Town Hall was a bit of a disaster for them. Now, there's a little bit of controversy about Bernie and Andrew Yang, and I think Buttigieg is going on. Buttigieg is going on shortly. About 10 years ago, there was a concerted effort to make to convince Democratic politicians not to go on Fox because you did not want to validate their propaganda operation as some type of news organization. But there was a feeling that if you were to go on, you want to undercut their message. And very few people are capable of doing it. That guy, Bregman, who he had on, Rutger Bregman, did it very well. Of course, he ended up getting bumped, and but was able to release the stuff. You want more examples of Donald Trump having, issues with what happened on Fox. At first, he was sort of like, and then it started to seep in that it was really problematic for him. And he was on Twitter raging last night. Many Trump fans and signs were outside of the Fox News studios last night and now thriving. Thank you, President Trump, speaking to himself. Bethlehem, Pennsylvania, for the interview with crazy Bernie Sanders. Big complaints about not being let in, stuff with Bernie supporters. What's with Fox News? I believe it'll be crazy Bernie Sanders versus the sleepy Joe Biden as the two finalists to run against the best economy in the history of our country and many other great things. I look forward to facing whoever it may. May God rest their soul.
Wow.
Whoa.
Is that his name for Joe Biden now? Sleepy
Wait,
Joe?
is that a death threat?
He's just saying, may God rest their soul.
Yeah,
I don't
a
think
debate.
I'm just throwing stuff out there.
It's just a
He
debate.
hopes
Okay.
they get a good night's
It's just
sleep.
my
So,
words, man.
Fox is in triage.
It's like
Over
it's not enough that they're
so
full
they
of
literally,
propagandists. They need emotional care for him as well.
and the White House must be aware of this. I mean, this is an all hands on deck moment when you send at this stage right now, because you want to this is not when they wanted to roll her out. The Trump appointed bureaucrat in charge of Medicare and Medicaid in the Trump administration, and they're bringing her out now. This is way early for this. Way early. Much earlier than you would have wanted to. And they actually sit her down with Kilmeade, Brian Kilmeade, right?
They're Medicare expert.
Yeah, they're Medicare expert.
I know
Seema
so
Verma
much.
is the administrator for Centers for Medicare and Medicaid Services. Administrator Seema Verma, thanks so much for joining us.
My pleasure.
So all this talk about Medicare for all really hits your office specifically. Can that work?
Well, I've been saying that Medicare for all is the biggest threat to the American healthcare system. What we're talking about is stripping people of their private health insurance, forcing them into a government-run program. So this is a bureaucracy that's going to be making decisions about everybody's health care, what kind of benefits that they can have, what kind of medications that they can have access to. And if we look at other socialized countries that have tried this approach, what do we see there? Long wait times, poor quality health care, and that's why those people are flying to the United States to get their health care.
But people say, wow, I'm a senior. I like that. I like Medicare. It's working for me. So why not give it to everybody?
Well, look, as the head of the program, I can tell you that Medicare is a sacred promise that we have made to the American people. They have paid their entire lives into this program. And now we're talking about putting millions of people into a program that was designed specifically for them.
Right.
And what that's going to mean is that they're going to have to compete to get care. That's putting them in line for their care. And I don't think that's fair. And the reality is we're having problems today paying for the Medicare program. And the trustees have warned about the solvency. So just adding more people to the program is just going to exacerbate it.
Right. This is roughly what his plan looks like. Let's just
Pause
take
it for 1 second. It will exacerbate it if there is no more funding. But no one has proposed no more funding. Obviously, if anything, it will expand the services for Medicare, and it will put it on more solid financial footing because of the dedicated resources to the entire program.
And exacerbate it.
Right. This is roughly what his plan looks like. Let's just take a full screen of this. Transition U.S. to a single-payer system over 4 years. No premiums, deductibles, only minimal co-pays. Cost estimate $28 to $32 trillion. And he claims that $28,000 is now spent for a family of four for health care. And that $32 trillion will be over 10 years. How does that look?
Well, essentially what this is he's saying we're going to essentially just move all of these costs to the government. But that just means higher and massive taxes for the American people.
Well, again, it is, yes, higher taxes. And Bernie already led with that. So they're really having a tough time figuring this out. Now, Donald Trump was reported the other day is spending a ton of money on Facebook ads geared towards old folks on Facebook. And this is going to be what they're going to try and motivate. They're going to say that Medicare for all is going to ruin your Medicare. Now, Seema Verma, of course, was formerly a healthcare consultant to states, teaching them how to get around Medicaid implementation and how to set it up in such a way that you could get a waiver from the government, so that you could actually continue to increase the profits of private insurance. Invisible to the public, wrote Indy Star. Vima's work has included the design of the Healthy Indiana Plan, a consumer-driven insurance program for low-income Hoosiers that's now being touted nationally as an alternative to Obamacare. In all, Vima and her small consulting firm has received more than $3.5 million in state contracts. At the same time, Vima has worked for one of the state's largest Medicaid vendors, a division of Silicon Valley, Giantech, Hewlett-Packard. That company agreed to pay Vima more than $1 million and has landed more than $500 million in state contracts. Imagine that. Synergy. During your tenure as Indiana's go-to healthcare consultant. I wonder who it was that brought her to the White House. Mike Pence. And because, you know why? Because she understands how you can both make money and make money as long as you're taking it from both that's what is known as a public-private partnership. And it all ends up in her pocket.
The problem with bureaucrats is they can't take a cut like that.
That's right. But I'm sure it's going to enhance her consulting business when she's done with this. All right, folks.